Now we're here with Naruschka Henriques, located in Harley Street. Now this looks like a very interesting treatment. So
this is amazing. Did you see, just even the little bit that she's been doing, it is crazy to look. Wait till you get up and see what she did. But look how it's just straightened out the entire nose.
So what are we doing here? I mean, are we doing a treatment for the nose? Because typically we all know that if we are going to correct something on the nose, we always think of nose.
Yeah, like surgery.
Nose job surgery.
Mm-hmm. Yeah.
So what are we doing?
Absolutely, it's just like that, except we're not going under the knife, so we're not opening the nose, and we're just doing some simple injections to just manipulate the shape of the nose and perfect all the little areas where it's a bit, you know, unsymmetrical, to make it straighter from the profile and looking at the nose straight on. And we're also going to lift the tip a little bit. The tip's a little bit going off to the left, so we're going to straighten that for Isabella. And we're also going to correct this little area below the tip as well, so that we have that consistency going all the way through the nose.
So is this sort of the typical patients for this? Obviously I've got like a bump, and I think there's a lot of people like a bump, so this is a great treatment if just to soften things and smooth things out. Is that right?
And
absolutely.
And if you did, like, if you tried to smooth the bump, would it make your nose larger? Or would it be, who would you prefer to do that? In what way?
It's an excellent treatment for nose bumps.
Okay. So we both have bumps.
yeah, sorry, we're asking about ourselves actually. Yeah.
They're very
all
common.
about
They're
us.
very, very common. Everyone seems to have a nose bump.
I know.
But you know, the wonderful thing is that it's treated in about 10 to 15 minutes. It doesn't
surgery, swelling.
Yeah, absolutely,
Yeah.
absolutely. You know, you don't have that downtime. Next day you can just resume your normal activity. Nobody's going to know. You might be a little bit swollen, but that can be managed. And you know, it's just not an obvious thing and not so disruptive to your everyday life.
Would you say the only negative thing would be like someone would have to come back and have top-up treatments versus, you know, surgery, which is more permanent?
Absolutely. I mean, you do have to maintain it, but each time,
Yeah,
it really is. You know, each time you maintain it, you get something that stays with you, and that's all the collagen that stays behind. So it never really reverts back to its original state. And you know, each time you maintain it, you do it less frequently too.
So this is using a hyaluronic acid filler.
That's right. Yes.
You've treated half the face so far.
Yes.
Okay, so we're really excited to see the results. We're going to come back to you and see the final result
already. Okay.
Great.
Great.
It is. I'm looking forward to seeing the results.
Yeah, this is still amazing to me. Like if you look from this angle, it's completely straight and it was curved. I'm not quite sure how you did that with fillers.
All right, should we sit up, Isabel, and see
yeah, sure.
the final result? Yeah.
So Isabel, sit up for me.
Wow, I mean, you can really see
it
that.
Really is something, huh?
Naruschka, just basically summarise what you've done there.
Okay, so what I've done is a few different things. We've actually straightened the bridge because there was a little bit of deficit volume above the bone here in the centre of the nose. This is what we call the bridge. So this has allowed Isabel to achieve a really nice straight line. There's still a curve.
And it tipped up a little bit.
Absolutely, lifted the tip. And also there was an asymmetry just above the tip where one side was a bit flat and a little bit low. So we've evened that out and made it symmetrical. And just below the tip, if you lift your face, Isabel, we've actually done some injections just here, just to straighten up that tip, to lift it up nicely and give you that nice line straight down the nose.
That's really, really impressive. Thank you
Really
so much
something.
for both of you coming
It's
in.
really beautiful.
You've done well.
It's
So far.
beautiful.